Okay, great. Thanks, Dinesh, and thanks, Sajith, and thanks to all of the team at Destiny as well for giving us this opportunity to talk to all of you today and to talk to you about nursing opportunities for you to then take up new roles and new careers in other parts of the world, including Australia, and also the education and the pathways and the process you need to go through in order to do that. So today we'll spend probably about 30 minutes talking to you about going through some PowerPoint slides with a whole lot of information in there. So if you don't catch everything, we'll share those PowerPoint slides with Sajith and the team at Destiny, and they can make those available to you as well. So we'll spend about 30 minutes doing that, and then we'll allow 15, maybe 20 minutes to answer questions for you as well. So if you have questions, either put them into the chat which would probably be the first preference, because then we can group all of the like questions together and then answer them at once so that everybody gets as much information as they possibly can. Okay. So that's what the next 45 minutes will look like. So sit back and relax. Make sure your volume's up so that you can hear me well. If I'm speaking a little too fast or with too much of an Australian accent, let me know. But you have now stepped into a little piece of Australia. Okay, so so this is the beginning of your journey down under and the beginning of your journey to Australia as well. What I'm going to do is share my screen with you, and it has a PowerPoint presentation that I will then go through, and that'll have some slides and some key information, and then we can get into some questions. So bear with me just a moment whilst I actually find that presentation, which would be really, really handy. So bear with me just a second. My apologies for delaying you here like this. Here it is. Okay, so we should be in good shape now. Let me unshare and then share again. Here we are. And away we go. Fantastic. Okay, so as I said, we're going to talk about a whole lot of things today. But one thing that I do want to do is to be able to make this larger. Sorry, guys, bear with me just one moment, okay? Sorry.
No worries.
It's all right. I just need to make this a little bit smaller so I can make this a little bit bigger. So here we go.
I think, Simon, the last option would
you
be
think?
Yeah.
Reshare it with my coach, eh?
Sorry, at the bottom, if you can see the
Oh, there we are. Yeah, all right.
Yeah, that's it.
Look at that. I'm normally giving you instructions, mate. What's going on? Okay. All right. So look, thank you. And thanks for a few minutes for me to sort out my technology. Dinesh will remind me of this minute for weeks to come about how I was technophobic as well.
No.
Okay. So as I said, today we're going to talk about nursing registration in Australia. That's the first thing. Then we're going to talk about jobs and about what's happening in the jobs market in Australia, because that's the reason why you need to know what sort of work you would be doing, where you might be doing it, how you might be paid, etc. And then we'll talk about education and how, particularly for our diploma qualified nurses who have joined us today, some additional education you'll need to do in order to then be eligible to apply for registration in Australia. So we'll cover those three main things, and hopefully by the end of this discussion, you'll then have all that information. So let me get started with first of all, a little bit about us. So the Institute of Health and Management we're what's called in Australia a higher education provider, which means that we are for postgraduate, so bachelor, master's, and in a few years, doctorate courses. And we focus, as the name says, in health and management, specifically for the healthcare sector. Okay, so we're accredited by the Australian government, an agency called TEQSA, TEQSA, and that's the same government body that regulates universities and other institutes like us teaching higher education programs. So we specialise in nursing and health, as I said, and over the past 5 years, we've trained over 2,000 internationally qualified nurses to then take up registration in Australia. So our students are spread all over Australia and, to be honest, all over the world. In Australia, we have two colleges. We have a vocational college and a higher education college. Since our company started in 2007, we've trained just over 14,000 internationally qualified nurses to take up jobs in Australia and around the world. So in virtually, I would say, Dinesh, I reckon in every single hospital in Australia, there's at least one, if not 10 IHM or IHNA students who are now working as nurses, as leaders, specialists, etc., as we go along.
Yeah, that's right.
And as Sajid said earlier, that's something we're really proud of because our community is really important to us, just as your community is important to you. And we really look forward to hopefully welcoming you to the Health Careers and the IHM community and family as we progress along. So where are we? We have campuses in Melbourne, Sydney, and Perth. Okay. And you can see, if you know the map of Australia, I've just got my little cursor there. Down the bottom is Melbourne, which is where we are today. So the Destiny team, as well as myself and Dinesh. Perth out on the west coast, Sydney a little north of Melbourne. The photos down the bottom here they're just a sample of some of, but each one of our campuses has a nursing lab, normally 10 to 12 beds in each lab. They know this is just a bit of a student amenities area, one of our standard classrooms, another one of our labs as well. And later on, if we have a little bit of time, or Dinesh, we can share it with Sajith, is some of the virtual tours that we have for Melbourne, Sydney, and Perth campus as well. Because I think they'd be really good material so people can get an understanding of what we offer as well.
Sure, definitely. We
also have office and campuses in India. So we have campuses in Cochin and Kottayam. We also have a training center in India, in southern India, one in Dubai, one in the Philippines. We're putting a training center into Nepal. And we also have in 2022, we'll have a training center in Colombia in Latin America. Okay, so we are expanding our presence around the world. We'd be very interested also in looking at establishing a training center in Colombo, the same as we've just done in Hanoi in Vietnam as well. Okay, so let's get down to the business. When we're looking at nursing registration in Australia over the last 2 years has changed. So previously, if you were an overseas internationally trained nurse, you would be able to come to Australia and enroll into a 12-week training course with us or with another university or another college. And that course was in 2 pieces, 6 weeks of theory in classroom, 5 days per week, and 6 weeks in a hospital where you then got to demonstrate, and you had to demonstrate your nursing skills and practice. So that had been in place for many, many years, since the early 2000s. In 2020, the Nursing Council decided to change that process and to start applying the same process they use to register doctors and dentists and a whole lot of other allied health professionals as well. And so what they've now progressed along to is what's called an outcome-based or OBA process. And I'll talk about the process in just a moment. But first of all, it's really important that I'll just give you some information about the 2 pathways there are for overseas trained nurses. And let's talk about Sri Lanka specifically, to then pursue registration in Australia. So let's look at the top. Let's look at the bottom first. If you hold a 3 or a 3.5 year nursing diploma, you at the moment are not eligible for registration in Australia, because the minimum level of education qualification is a bachelor qualification, is the minimum level the Nursing Registration Board will accept in order to then process your application. So immediately that says to me, we'll talk in a moment about the education you need to do in order to then bridge to an acceptable level, bachelor or above, okay? If you're a bachelor qualified nurse, and I understand there's less bachelor nurses in Sri Lanka than there are diploma nurses, if you're a bachelor qualified nurse, you're eligible for registration now because you meet the minimum level of education qualification required by the nursing board, okay? So let's return to our diploma nurses. If you're a diploma nurse, you'll need to do a little bit more education, which is called a graduate certificate. And that's the first stage of a master's journey for you, okay? And we'll talk in a moment about the benefits of all of that. So you do this additional education, Then you're able to then proceed on and complete your OBA preparation. So there's 2 preparation courses, and then you're eligible and able to then go and participate in a 2-day exam with the nursing board in Adelaide. Now, let me catch all that in one easy to understand 5 steps. The main steps you need to really worry about is step number 1, which is where you are doing what's called a self-check. In other words, you go to the AHPRA website, and we'll show you the address in a moment, put in some details, and that website will then say to you, you are eligible for registration, or you're not, and you need to do some additional education, or you might need to improve your language, etc. Okay? Don't worry about step number 2 at the moment. Let's go straight to step number 3. Okay? Now, step number 3 is really, really important, and this is about the preparation for your OBA assessment. Okay? Now, the OBA assessment is in 2 parts. Step number 1, which you can see on the right-hand side there, is an NCLEX multiple choice question exam or test. Now, this is an online test. Okay? So it's an online test, approximately 200 questions, that the nursing board is then, you're able to go to a Pearson testing centre, and there's lots of those in Sri Lanka, and you go to your Pearson testing centre and you're able to take this 200 question multiple choice question test. As I said, it's an online test. Normally takes about 3 to 4 hours approximately to complete. Okay? And I'll talk to you in a moment about the preparation course that we run to help you get ready for the NCLEX testing. What I will say to you straight up front is this step determines whether you pass and are able to then be registered, or fail and have to then do the test again. So preparation is essential. There's approximately 55% of nurses who do not pass one of these 2 stages on their first attempt. Okay? So if you don't prepare, that 55% becomes about 85%, which means you have to then go and pay your testing fees again. You have to pay your application fees again. And each time that's approximately 5,000 Australian dollars if you don't do any preparation. Okay? So it's pretty important. So step number 1, online training course, because it's an online test. So we then teach you Australian nursing practices, Australian nursing standards. We teach you how to pass the test. Okay? And then you go and sit the online test in Sri Lanka at a Pearson testing centre. Okay? 200 questions, and within a few days, AHPRA will then, the nursing board will contact you and say, yes, you've passed the test, or no, you have not, which means you can then go and do some more practice and then sit the test again. The step 2 is the OSCE, or the outcomes-based assessment preparation. Now, this is all about practice, okay? Because the outcomes-based assessment test is held in Adelaide over 2 days. And in those 2 days, you will do 10 simulation stations, 5 on the first day, 5 on the second day, with live patients in a large number of them, okay? So each one of those 10 stations or testing stations is going to test you on your nursing knowledge, your understanding of Australian nursing practice, nursing standards, and basically, and then the question is asked to you, how would you provide care in the next 20 minutes for this patient based on their situation? 10 times, okay? One of those stations will be for Australian Indigenous and Torres Strait Islander health. So that will be, the patient will be in either an Indigenous Australian or a Torres Strait Islander, and you will need to understand best practice of how to provide nursing care to somebody, either an Indigenous Australian or a Torres Strait Islander, okay? So on campus with us in Melbourne, Sydney or Perth, 6 weeks, 5 days per week, 8 hours per day. Classroom in the morning, labs in the afternoon, etc. Okay? So that's the preparation that you need to do for your OSCE test. 30 days of training, And then you can also do additional lab time. We have lab assistants available all the time to then help you practice your skills if you're a little bit concerned about not understanding everything. And then you go off to Adelaide and you do your 2-day test. Okay. So that's the nursing registration process. Once you've completed your tests, you can then finalize your registration. And it's at this point that you then need to have finished your English language training so that you have IELTS 7 in all 4 bands, or PTE 65, or OET B. Okay, so let me just repeat those 3 language levels. Is IELTS 7 in all 4 bands, okay? PTE 65, and that's PTE academic, okay? And then OET B in all 4 bands, okie doke? So it's at this point, step number 4, that you need to finalize your English language, which we also will help you with. And then you can put your final application into AHPRA. And approximately 6 weeks later, you will get your nursing registration certificate for Australia, which means you are then registered to practice as a nurse in Australia. So at that point, you can then start to look for work. You can then also consider, once you have some work, you can then start looking at migration and residency opportunities, and the team at Destiny can talk to you about those. So they're the key steps. So let me just take you through those, and this is where we can get some more specific. So I talked about step number 1, the self-check. Just use your Google browser. Just go to Google or whatever browser you use. Just put in self-check NMBA. That's Nursing Midwifery Board of Australia. Okay, so simply put that into your search engine, and what you'll get is this website here. Click on the link. IQNM is Internationally Qualified Nurse and Midwife, okay? And that will then take you to the self-check. And the self-check will ask you to complete a number of questions. They're like drop-down menus. Are you registered? In which country are you registered? Your level of education, et cetera, okay? And this is when you get to this web page, this is the little tab you're looking for, that telling that you are ready to complete the self-check, okay? So nice and simple. Step number 2 is where you then simply once you've done your self-check and confirmed, you simply then lodge your application and your documents, and you pay 640 Australian dollars, and the nursing board will then do an assessment of make sure that everything that you have meets their standards, and then they'll issue you with basically an invitation to then complete the NCLEX examination, okay? So as I said, you'll receive that approval from AHPRA to do the NCLEX exam. They'll give you a link to the Pearson VUE testing centres. You book your space online. At the moment, it's 2 to 3 weeks ahead to book your space. But do be aware that if there's a COVID outbreak in different countries, it does mean that testing centres close or restrict the numbers of people, okay? And then you'll go through and you'll do your NCLEX test, okay? It can take up to 6 weeks. Normally it's about 2 to 3 weeks, and you'll get your NCLEX results. And that will then tell you to say, congratulations, you've passed your test. Now you're able to move on to prepare for or do your OBA exam, okay? One thing to remember is once you register yourself with AHPRA and push the go button for your NCLEX registration, you have 90 days to complete your your NCLEX test in, all right? So don't push, and again, talk to the guys at Destiny, talk to Dinesh and his team. Don't push the go button until you know you're ready to do the test, because you only have 90 days in which to do the test, okay? Otherwise, you have to go back to square one and start again and pay another $640, okay? So we're trying to save you a little bit of money here. Don't push go until you know you're ready, and Dinesh and his team, or the team, Sajith and the team at Destiny, would be able to tell you when to push go, okay? So that's step 1. Then we come to the OBA and the OSCE assessment. OBA is all about, it's a clinical, it's testing your skills and your knowledge and your competence. So from my knowledge and for me, and I've worked in the education and healthcare sector for just on 25 years. And this for me, I think this is a good positive step forward. So no longer is there a class where people can just hide down the back of the class and not do very well. Now they have to have their skills tested in order to be registered. So it's testing your skills to meet the Australian nursing standards and standards for Australian nursing practice. Okay. There is a difference between the way nursing is practiced in Sri Lanka and how nursing is practiced in Australia. There's a difference in hospitals. There's a difference in the course that you have done. There'll be a difference in the processes and the procedures that you use to provide nursing care in a whole range of different situations. So the Australian Nursing Board is testing your knowledge of the Australian nursing practice, which builds on your knowledge of the Sri Lankan nursing practice. Okay, so we take Sri Lanka and your nursing practice and we add some more knowledge about Australia, and you'll be ready to then be registered as a nurse, okay? As I mentioned earlier, OSCE is 10 clinical stations with live patients. So that means they're not mannequins. A number of those patients will be live human beings. Could be Dinesh, it could be me, who knows, okay? So you'll be asked to demonstrate how you would provide care in a live patient, okay? You're expected to demonstrate your skills and explain what you're doing. Okay, it's not just, and there will only be two people in that room. One will be you and one will be the testing person from the nursing registration board. Nobody else. Only if there's a patient, that person will say nothing. Okay, the fee for sitting the OSCE test is 4,000 Australian dollars. When you add to that $550 for your NCLEX test, and $620 for your initial assessment, that's $5,150 Australian each time. If you fail your OSCE test because you don't prepare, you don't do the preparation course, you have to pay another $4,000. And each time you don't pass, you have to pay another $4,000. So it's not like doing your NCLEX test where you can kind of keep going back and pay $350, pay it again, pay it again, pay it again. It gets very expensive very quickly, okay? So, and also there is a maximum number of times, normally about 3, that you can try and not pass before the nursing board says, can you take 6 or 12 months, go and study and practice, and then come back and try again, okay? For that 3 times will cost you 15,000 Australian dollars and you still won't be registered. So a small investment that I'll talk about in a moment in the preparation course is a much smarter thing to do as well, okay? Rightio. So if we move on, let's talk about the preparation courses. Now there's 2 parts, as you remember. Part number 1 is the NCLEX multiple choice question, 12-week online course. We do an online course because it's an online test. I spoke to a nurse a few weeks ago from India who had just done a 10-week preparation course in India, and she had been going to a classroom. And it wasn't until the very last day of the test that her testing center said to her, oh, it's an online test. You know it's an online test. And she said, well, why? I don't have a computer. I have a mobile phone and that's all. How do I practice? And they said, well, we don't know. We don't have computers either. So here's all the sheets, here's all the paper, and off you go. So make sure you're doing an online test if you're doing NCLEX preparation, okay? It includes the test preparation, live group discussions, theory classes, because we also teach you Australian nursing practice. We don't just teach you the tricks of how to pass the test. We teach you how to answer the questions correctly, okay? In addition, every day we will send you five questions every single day. You will get another 5 questions that you answer, and then you discuss those in your next class. So you're practicing all of the time during the 12 weeks as well, okay? Why would you do this with us versus others? Number 1 is it's an online test, so we teach you online. 24/7 support. You have a question, you simply call our support, or you simply get online and communicate with our online support people who will then help discuss that with you. Excellent online learning platform. We use Canvas, which is a very simple online learning platform. All of our faculty are highly skilled and experienced, and guess what? They've passed the NCLEX test in different parts of the world, okay? They've passed it in the UK, they've passed it in the US, they've passed it in Canada. So they know what they're doing, okay? So that's the NCLEX test. The second preparation course, remember part 2, is for the OSCE preparation. Now this room you can see here in the photograph is one of our simulation labs in our Sydney campus. Okay, now there's what, 1, 2, 3, 4, 6 beds there alone. Okay, each one of those is set up as an Australian hospital ward would look, as the same as an OSCE testing room. So you will spend a lot of time in there practicing, going through simulations and demonstrating how you can provide Australian nursing care. It's a 6-week course, Monday through Friday, 9 a.m. till 5 p.m, so 8 hours per day. And you can do that in Australia, India, or the Philippines from August in the Philippines, okay? Course fee is 5,500 Australian dollars. There are scholarships available, and Dinesh can talk to you individually about your individual situation for scholarships. The simulation training, which is the lab here, and each of in Melbourne and Sydney and Perth, we have the same facilities, is where you'll be spending a lot of your time as well as the classrooms. And it's really there to develop your understanding of the Australian healthcare system and how nursing care is provided in Australia, okay? Why would you choose us? Because we're doing tutorials and demonstrations, including the simulation. So what you do every day is what you will then simply go and do when you do your exam. Online learning resources, virtual simulation, and peer-assisted learning, okay? Which means you're discussing with other experts in our Sydney or our Perth campus if you were in Melbourne, for example, okay? Daily OSCE practice in our nursing labs. These are fantastic labs. These labs are as good as any hospital, 24/7 student support, okay? So 5,500 with scholarships available. I can tell you now the previous course here, this course is $3,500. A scholarship would bring you to the scholarship we're offering at the moment is $1,500 scholarship. So that makes that course $2,000, for example. Okay. Right. Now let's talk about, before I go on to here, let's talk about jobs. The Australian nursing sector as a whole has a shortage of nurses over the next decade, so by 2030, of approximately 230,000 nurses, okay? There's 2 very simple reasons for this. The first reason is that Australia's population is getting older. Like me, they're aging. By 2030, 65 and over Australians will be the largest proportion of the population. There's always a gap, and Australia for many years has had a gap between the number of new nurses that we are training and the number of nurses who are leaving the nursing profession. The gap in the middle is filled by overseas trained nurses like yourselves. And that number is growing each day. And the COVID pandemic, and Australia having its borders closed for the past 15, 16 months, and will until this time next year, has made that much, much worse. So our demand will be well over 200,000 nurses by 2030, which is only 9 years away. Sounds a long way away, but it's very close, okay? So what does that mean? That means there are jobs. When I looked at one of our online job boards, such as Seek in Australia, on Thursday, there were 9,842 nursing jobs in Australia on that day, 9,842, okay? So that means if there were 10,000 new nurses arrived in Australia tomorrow, every one of them would have a job to go to. So that's pretty astronomical, okay? So that means, let's talk some money to start with, because let's face it, we all work to earn money. We all earn money in order to have a good lifestyle. If you are a bachelor qualified nurse who is what I'll call a staff nurse, so you're registered you have no postgraduate study, you have a bachelor qualification, you'll earn between $60,000 and $65,000 per year as a staff nurse. And that means you'll do 3 weeks of mornings and afternoons, 1 week of nights on a 4-week rotating roster, okay? $60,000 to $65,000. If you are a master's qualified nurse, so you're a specialist and you have a master's qualification, you'll earn between $90,000 and $100,000 per year. That's 30% more by having a master's qualification. So why is that? That is simply in place because the Australian healthcare system, along with a lot of other countries, the UK, the US, and around the world, the demand or the skills that are needed are specialist skills and less so general nursing, generalist skills. So that's why in a moment, I'm going to talk to you about the benefits and the very strong benefits of pursuing postgraduate study, because it helps you with 2 things. It helps you improve your career, get paid more money, that's 2. And 1 more, which is number 3, is it's going to help you a lot with your migration to Australia as well. So the thing on the right-hand side, upper right-hand side, you can see a little wheel, a colourful little wheel, which says AQF. That's the Australian Qualifications Framework, okay? So let me just explain something about this for you. The diploma that you hold at the moment is going to be approximately a level 6 qualification. Now, you remember a few minutes ago, I talked about the Nursing Registration Board needing a bachelor level qualification in order to apply for registration. A bachelor is a level 7 qualification on the qualifications framework. So at the moment, if you're a diploma holder, you sit here, okay? You're not eligible for registration. You need to be either here or above here, 8, 9, or 10, okay? If you're a bachelor qualified nurse in Sri Lanka, that will be seen as equivalent to an Australian bachelor, but you will need to do the OBA, NCLEX and the OBA pathway, okay? So let's talk about 2 courses and let's talk about how we then help you use those to get from here to here and to be eligible for nursing registration, okay? First course is the Master of Nursing, which is an AQF level 9 qualification. This is a 2-year course that I'll give you some information on in a moment. If you were to come from start here at this with studying the Masters, you would go straight from here. 2 years later, you're going to here. You're earning 30% more as a Master's qualified nurse, and you're eligible for a 2-year post-study work visa. And you may also be eligible for additional extra points as part of your permanent residency application, okay? So there's lots of benefits to go from here, level 6 to level 9, by doing 1 2-year master's qualification. The first step of that process is the Graduate Certificate in Nursing, which is a 6-month course, and it's the first step of a master's course, and that will take you from a 6 to an 8. Okay, and that is we have hundreds of nurses from India, a large number from India, less so from Malaysia, other countries who have studied a 3-year or 3.5-year diploma. They're at level 6. They need to get above 7 or above, and they have 2 choices. They could either do a bachelor course, which is 3 years in Australia and generally costs somewhere around 65 to 75,000 Australian dollars. So they would then do that bachelor, then they're eligible for registration. We think we've got a better option. And as I said, we have hundreds and hundreds of nurses who are following this pathway and then are registered and working in Australia. And that's to go from here to a level 8 graduate certificate qualification with this course. And I'll tell you in a moment, it's not going to cost you $65,000. So let's start with the Masters. Master of Nursing, as I said earlier, is an AQF level 9, okay? This will mean you are then in the senior level of nursing. So you would then be pursuing nursing leadership, specialist roles, etc. 104 weeks, that's 2 years course. AQF level 9, as we've spoken about. And it includes an elective unit to do 120 hours of placement. That's 1 month, 4 weeks in a healthcare facility. Okay, that's one of the electives in the course. To enter, you must have IELTS 6.5, no less than 6 in any one band. And the key benefits is you would be eligible for a 2-year post-study stay-back visa at the end of that course. If you study in Perth, because it's a regional area, you'll be eligible for a 3-year post-study work visa. Okay. You may also, and I say you may also be, and you'll need to confirm with your migration advisor or your or with the Department of Home Affairs. You may also be eligible for 5 extra points because towards your PR application, because you have a master's qualification versus a bachelor qualification. You may also be eligible, if you study in Perth, for an additional 5 points because you're studying in a regional area rather than Melbourne or Sydney, which are categorized as metropolitan. And the guys at Destiny will be able to provide you with information about how the migration system works in Australia. But it's all based on points. You earn points based on your level of qualification, English skills, work that you do, etc., etc. Okay, so the more points you have, the better your chance of being invited to apply for permanent residency. Okay, so that's the first part of our master's course. Now, let's look at fees because fees are important. The total cost for the course is $47,200, and that includes the NCAP 1 and 2, the nursing registration preparation courses that we talked about earlier. Okay, so that includes those in that fee of $47,200. If you said, no, I don't want to do the nursing preparation yet, I'll just do the master's, then we will deduct this amount from the fees, and that's what you come at $43,450. Okay. Now let's talk about Australian borders because Sajith, I'm sure it's probably the number one question on everyone's lips.
Surely.
Australian borders are unfortunately still closed. And the government tells us they will be closed until early next year, somewhere around the middle of the year, but they won't be specific, okay? However, that should not stop you getting started on your journey to Australia. My view is that this is the perfect time for you to get started from Sri Lanka and then be able to not waste any time and finish your journey in Australia faster, okay? And we've put in place a few things to help you do that, okay? So if I'm looking at the master's program, which remember is a 2-year course with lots of benefits, whilst the borders remain closed, so whilst Australia's borders, while we're waiting for Australian borders to reopen, okay, we are offering the first part of that course. So the first unit, the first 6 months, which is 4 units, for $5,500, okay? Once you complete that first 6 months, and that's the first semester, and there's 4 semesters in the course, then we simply pay an additional $39,000 for semesters 2, 3, and 4, okay? Now that again includes NCAP 1 and 2, nursing registration preparation. If you don't want to do that at this stage, you might say, I'll do that later. I just want to concentrate on my studies. Then the fees for semesters 2, 3, and 4 would be only $36,000. Okay. So we've reduced the price of the first semester because with the borders closed, you will be studying in blended delivery, which means online with loads and loads of support from our educators and from our lecturers and our tutors. Okay, so because we recognize that, we've tried to make the first semester affordable for you. Okay, remember, if you're a diploma qualified nurse, you must successfully complete this first semester in order to then be eligible to go on to the rest of the master's course. If you hold a bachelor qualification, you're eligible to enter the course. If you're a diploma qualified nurse, you will need to do the graduate certificate in nursing, so the first semester, pass that, and then you're eligible to finish off the rest of the masters. But we will give you credit for the units that you've already studied. Okay, so it's simply so that you do two things. You will then be eligible to apply for nursing registration, and you will then also get credit of this amount to then be able to finish your master's course off. Okay, so hopefully that makes sense. There's three things. Let me just recap three things for you. Because the borders are closed, we'd like you to focus on the first semester. And Sajith, I think this is probably fairly relevant, is fairly important. We'd like students to concentrate on their first semester. Now, they could do that as a full-time or a part-time study load, which means it could take 6 months. They could do 2 units per semester and take 12 months, okay? Which means, because then they can fit it in around their study and family and all, this is a very, very stressful time. Anyone who works in healthcare, and as you said, acknowledged all of these nurses earlier, they're working 12 and 14-hour shifts. They're living in dormitories near the hospital, etc. So maybe a part-time load is a good way to go as well, okay? That means they'd spend 12 months instead of 6 months, but they'll be able to finish that first semester. Once that's done, they're then eligible to enter the course, and then they can come and join us in Australia when borders are open, okay? So that's what we've put together for masters. Now let's talk about the graduate certificate. Now, as I said earlier, a graduate certificate is a level 8 qualification. So this is primarily targeted to our diploma nurses who are on this discussion today. And this will help you get from a level 6 over level 7 all the way to level 8, okay? And that means you will then be eligible to apply for registration. So if you don't want to do the masters, if you're not thinking about masters at the moment, all you're thinking about is, I just want to get registered in Australia, then this is the pathway for you. 6 months course, 4 units, that's a full-time load, or you might choose to do part-time load, which is 2 units in semester 1, 2 units in semester 2, okay? Because it's postgraduate study, it's progressive tests and assignments, okay? You don't study, and then just do one big exam at the end. You do progressive tests and progressive assignments and assessments all the way through. There is no practical placement in the graduate certificate. So you can study this course in Sri Lanka online in blended delivery with our tutors and coaches, okay? It is a pathway to Master of Nursing or directly to registration for diploma holders, whether you've done a 3 or a 3.5-year diploma, okay? The cost for this course is $5,500. Only $5,500. That's about a 45% scholarship we're offering at the moment because the borders are closed and because to be honest also, because nurses are working so hard to keep the rest of the community safe and well. Okay, so just to recap, you are here level 6. If you're a diploma holder, you need to get over, either here or over. This course will take you over because it's a level 8, and that means you will then meet AHPRA's requirements for registration, and away then all you need to worry about is your language level, and away you go. Okay, just don't forget though, this pathway means you would be working as a staff nurse. So earning somewhere between $60,000 and $65,000 a year, okay? The previous course, when we look at masters, is a 2-year course. Remember, if you've done the graduate certificate, you've already done the first semester. There's only 3 semesters to go. And then you'll be working as a specialist nurse, master's qualified specialist, which means you'll be earning $90,000 to $100,000 a year. So 30% more. So when I look at these fees, in 2 years, you will have paid for your course out of your increased earnings, okay? That's a very short time in order to repay all of the study, and then you continue to earn at $90,000 to $100,000 a year, okay? And I will say Sri Lankan nurses are very highly regarded within the Australian healthcare system. Your professionalism, your personality, your caring nature is very, very highly regarded as well. So that's why there are it's a good number of jobs and roles available as well. We've just got 2 more slides, and Dinesh, maybe if you want to talk to these, this is to provide a bit of an option for nurses who might be considering going to New Zealand to begin with.
Yes.
Because there are nursing opportunities, many in New Zealand, as much as there are in Australia.
Exactly. Yeah. So, so as Simon said earlier, we have this OBA. We have to get the international nurses has to complete OBA to get registration in Australia. There is another way around, which is completing a CAP program in New Zealand, because New Zealand has still got the bridging program. So those students who are a bit worried about OBA, or they might think that OBA will take a bit longer time to get the registration, they have a second pathway through New Zealand. For example, if if a student who is a diploma holder, they have to first upgrade their qualification, as Simon said earlier, upgrade their qualification from AQF level 6 to AQF level, at least AQF level 7 is required, but with GCN, they are upgrading from AQF level 6 to AQF level 8. With that qualification, they are meeting the qualification requirement set by New Zealand Nursing Council. So with that qualification, they can meet the eligibility for the CAP program. CAP program is the bridging program in New Zealand to get registration over there. So with that program, they are, after completing GCN, they're meeting the eligibility for CAP program. Then they can appear for the CAP program, which will be around 3 months. After completing the CAP program, they can apply for registration with the English test. So that's the another pathway for all these diploma nurses, or even for bachelor nurses. So bachelor nurses, it's not mandatory to do the graduate certificate in nursing, because they already meet the qualification requirements set by the nursing council. So the bachelor nurses, they can straight away appear for the CAP program. They can get registration in New Zealand. For diploma nurses, they can complete the graduate certificate in nursing, meet the qualification requirement, complete CAP program, get registration in New Zealand. And if they would like to convert their registration in New Zealand, because they already got the registration now after completing the CAP program, they would prefer, some students prefer to come to Australia, because there are more opportunities in Australia, and salary wise, there is more salary in Australia compared to New Zealand. For those people, there's another option which is available, which is called Trans-Tasman Mutual Recognition Act, which is actually an act between New Zealand and Australia. With that act, these New Zealand registered nurses can transfer their registration from New Zealand to Australia, or vice versa. If an Australian registered nurse wants to work in New Zealand, they can transfer their registration to New Zealand so that they can work any of these places. So this is kind of another way around to get registration in Australia with graduate certificate in nursing pathway program.
Thanks, Dinesh. And the reason we include that is because some nurses just do not want to do an OSCE assessment. They have 500 questions for us, trying to find a way around not having to do an OSCE assessment. Now, so New Zealand is one of the last countries to use a course. So a study course, as Dinesh said, a 12-week course to train nurses. Australia used to, we don't do it anymore. And I would say within 1 to 2 years, probably 2 years, New Zealand will also stop using CAP. Okay, but some nurses do not want to do a skills test. They want to do a classroom-based academic course. So this is another pathway for them. But again, if you're a diploma holder, you need to go from level 6 to above level 7. So level 8 is a better way in order to be eligible to do that test. Okay. And I kid you not, Dinesh and I think the most, I've had 38 questions somebody asked me once, trying to find a way around having to do an OBA assessment. Exactly. At the end of the day, there was no way for her. She went and did it. She started to do the preparation NCLEX, and she did really, really well. She just didn't trust her ability. Okay. So if you are a great nurse, which I'm sure you all are, and you have great skills, you will have no trouble with the NCLEX and the OBA preparation as well. Trust in your ability and trust in your skills. Okay.
Exactly. And especially, we have been training international nurses as part of IHN and IHM for the last 14 to 15 years. We exactly know what an international nurse is lacking and what is their ability, what is the area where they need to improve. So with our IHM's preparation programs, we can train the international nurses with our preparation program and get them into the registration pathway, especially to train them for the NCLEX and OSCE preparation. Actually, the OSCE is a part of the current bridging program, which is already over. OSCE is actually a part of the bridging program. So we have been giving the OSCE preparation. We have been giving the OSCE to the students for many years now. So our educators are specialists in training the students in OSCE.
Fantastic.
So,
Thanks, Dinesh.
So,
excellent. Right. So I think that really starts to bring us to why choose IHM. I've talked about these a few minutes ago. Experienced faculty. One of our specializations is in preparation for registration, be it nurses, be it dentists. We currently train dentists to be ready for prepare for registration. We're going to be starting to train doctors later this year in November. And in 2022, we'll be moving on to physiotherapists and other allied health professionals. So we know what we're doing. You just need to trust us, join our community, become part of the IHM community, and we'll help you live basically create the opportunity for you to then fulfill your dreams. State-of-the-art facilities, you've seen the photographs. You're more than welcome. If you have a family member in Australia who you would like to come and visit one of our campuses, please let us know. We're more than happy to host any visit, anyone who would like to come and have a visit, to then come and actually confirm that yes, this college exists, and yes, these are the facilities that they have as well. Okay, come down and meet Dinesh and I. Send your auntie, your uncle, your cousin, your cousin's cousin, and we're more than happy to spend time with you as well. Online learning platform, unfortunately, because the borders are closed, this becomes important. So it needs to be easy to use. It needs to allow us to connect our coaches and our tutors with you and the lecturers as well. And that's what it allows you to do. 24/7 support, any time of the day, 7 days a week. We have, and our student support and academic support people are there to help you, because our job is to help you pass and fulfill your dreams, complete your course. That's it. So the next slide says questions. I notice in the chat room there's 15 already, which is fantastic.
Yeah.
And so how would you like to tackle those, Sanjeev?
What I could do, I have filtered some of the questions, Simon,
Fantastic.
and thank you so much for you and Dinesh for presenting and educating our nurses who was eagerly waiting to see how easily and how conveniently I can be an Australian nurse. So out of the questions, I will quickly ask, because we will anyway, we will spare quality time to answer them. After that, they will hear the best part from Amila about the migration path. Is that all right, Amila? We will shall we first answer to the questions and we'll move forward, Amila?
Yeah, that's okay, Sajid. As the way you want. If you want some more further time to get prepared with the questions, then I can do my session. Otherwise, I can do it later. That's okay.
Okay, I think. Yep. So we'll go with 2 sets. So then they will have, because I have already gathered the questions. Then with the hot information that they have, they will clarify the doubts that they have in their mind for the pathway first. Thank you, Amila. So first question, let me open it up. Is one student just asked multiple choice question MCQ regarding nursing theory, or what kind of area that will be covered.
It's covering a whole range of areas. So it's covering nursing theory, it's asking nursing practice, understanding of nursing practice, how to apply nursing practice. It's the way the test is designed is it's not all the questions are yes or no. It's asking you which question is most correct. Okay. So you might have 4 answers. They're all correct, but one of them is more correct. So you need, and that's why when we teach the test, we don't just teach the pattern, 1 A, C, D, B, 1, whatever. We teach the knowledge, because once you have the knowledge and they change the sequence of the questions, you can then answer the question without having to think, oh goodness, this was A, but now it doesn't look like A. I'm lost. Okay. So the questions are multiple choice questions primarily, and frequently they're asking which answer is most correct in a particular situation. So, for example, Simon was admitted to hospital emergency last night. He presented in this condition, A, B, C, and D. He has been he was admitted overnight. This morning, his condition is D, E, and F. Which course of action, which care plan might you think is most correct for Simon's condition this morning? Okay. So you need to understand how to analyze and critically think through that my condition the next morning. And then which care plan might be which course of action is most suitable given your thinking as you've critically analyzed my situation. That's essentially how the NCLEX test works, okay? That's why we send 10 questions every day, because we want the nurses thinking through, critically analyzing. I'll tell you now, Sajith, most of the calls we get to our 24/7 support center are at 10 and 11 and 12 o'clock at night.
Oh.
Because nurses finish work, they go home and they do all the stuff they need to. Often they've got kids or husbands and things. They then sit down to think at about 10 and 11 o'clock at night. And they're going through questions, and that's when we get most of our calls. We don't get them at 2 o'clock in the afternoon because they're working.
Yes.
So that's essentially how the MCQ test works. If you prepare, you'll breeze through. If you don't prepare, it's not an easy test.
Yeah. Thank you.
Exactly. That's we provide these in a preparation program designed for them to choose the best answer from that.
Yeah.
So with the group discussion, they will discuss the students and the educators. They will discuss why this answer is the best answer. So that's how they come to that conclusion.
Thanks so much. Okay, that's what we love. IHM is doing more practices for our nurses to do their testing and how the support, the best assistance the qualified faculties being given for the students. Thanks so much again. And the second question, someone again just asked about if we already have Bachelor of BSc bachelors, are we need to apply both master and OBA pathway? Can't we apply OBA pathway only?
Short answer is yes. So yes, you can do just the OBA. The difference will be that your registration will then be as a registered bachelor qualified registered nurse. So you'll be a staff nurse. Okay. Versus if you were to do a master's and OBA, you would then be registered. You'll finalize your registration with a master's qualification. And when you finish your master's, you will then be living and working in Australia for 2 or 3 more years whilst you then finalize your permanent residency. So let me just spend a minute on this, Sajith, if I may. If a bachelor qualified nurse was to go through NCAP 1 and 2, they would do NCAP 1 online in Sri Lanka.
Okay.
Once borders are open, they can either come to Australia, or they might go to India down to our campus in Cochin, or they might go to Dubai, for example, to then go and do their OSCE preparation. They then come to Australia to do their OBA test. Now, that's a 2-day test. So they will probably come on a visitor visa. Okay, 3 months. Then they've got to leave when they've done their OSCE test. Right? They have to leave because it's only a 3-month visitor visa. They're not on a student visa. All right. Then they go back to Sri Lanka. They then go and try and find a job and go through all that process, etc. Try and find a job. Try and find a way to get back to Australia with work visa and all the other stuff that you guys know just as well as I do. Okay. If they are doing the masters in addition, whilst they're studying their masters for 2 years, they're then finalising their registration. By the time they finish their masters, they have their 2-year masters. They have their nursing registration, and then they have 2 or 3 more years working and living in Australia full time, during which time they're earning money at Australian dollar rates, $90,000 to $100,000 a year, $80,000, $90,000, $100,000 a year, and they're then applying for starting their permanent residency process. Okay. So 2 different pathways. If you just do NCAP, bachelor qualified nurse can start NCAP, NCLEX in late July. We have a course, we have an intake starting then, and every 12 weeks we have another intake. They can join the next intake, no problems whatsoever, but they will have to leave Australia when they've done their OBA test because they're not on a student visa, they're on a 3-month visitor visa instead. Okay?
That's very clear, and thank you so much, because that will be again explained in future when they come to the migration paths as well. I'll move forward for the next question. Again, it's a very simple question. You can quickly give the answer about the English requirement for both the OBA, GCN, and the Master of Nursing, plus the APRA register when the time they need to get the
Okay, so let's break this down. OBA, so NCAP 1 and NCAP 2, there is no minimum English language requirement. Okay, so there is no minimum English language requirement, but they must be able to obviously communicate in order to participate in the course. Okay, so that's for NCAP. You do not have to have your final language certificate when you do your OBA test. Okay, because you don't have to have that until after you've passed your OBA test and you lodge your final documents. But you still need to be able to communicate. So you should be getting very close to IELTS 7, PTE 65, or OETB. Third part of your question. Entry to graduate certificate or master's is IELTS 6.5, no less than 6 in one band. PTE 56.
58.
Or
Sorry.
58. Sorry, yeah. Thank you very much.
No, it's all right.
Or OET and a clubbing of B and C. Okay.
Yep.
So hopefully that's nice and clear as to the different language.
Yep. Thank you so much. And some just requested about the age limit. Maybe Amila also answered the question in future about some age limit. But for the qualification wise, what will be the age limit that you can accept for, let's say, for GCN and the Master of Nursing?
There is none. The age limit becomes a migration consideration rather than an entry to the course. So we have students who are 45 and 50 years of age, because they're changing careers, they've been a general nurse and now they're wanting to diploma qualified nurse, now they're wanting to get their masters in order to progress on. So the age is a migration question, not an entry to the course question. We have no minimum or maximum age.
Thank you.
Yeah, I'll answer to that when it comes to me.
Yeah, thanks, Amila. And also, maybe Dinesh, as he covered about the New Zealand pathway, it's the requirement for the CAP. The one student is asking about what are the requirements for CAP course.
So to become eligible for the CAP program in New Zealand, first of all, they have to be NZQF level 7 qualified, which is bachelor or BSc qualified. They have to be minimum bachelor qualified. But if they are not, if they are diploma qualified, they can upgrade their qualification with graduate certificate in nursing with IHM. Okay, then they meet the eligibility by the qualification standard. Then they have to meet the English requirement. New Zealand Nursing Council doesn't accept PTE, so they accept only IELTS and OET. IELTS 7 each or OET B. So they have to, that's how they meet the eligibility for the CAP program. And also after completing CAP program, when they're applying for registration, then also they have to present the English test. So the English tests are normally 2 years validity. So if they have completed or if they have got the English test just before the CAP program, they can still use the same English test for the registration purpose.
Yeah, thank you so much, Dinesh. Even though a bit of from a different country program, thank you so much for answering for the accuracy. And this is a very good question. Like the minimum score for pass the NCLEX. What is the minimum score for?
It's a pass. So it is, so you need to pass. So obviously if it's 200, if it's approximately 200 questions, that would then be 50%, 50.0001%. Okay. And then what that does though, Sajith, is that assists what APRA does when they're assessing overseas internationally qualified nurses. They're assessing them into bands, so streams. Okay, so different streams, and the streams are based on how you participate in NCLEX test, how you answer. When you saw earlier, level stage 2 is an orientation course. So how people respond to questions in that orientation course. If they answer them well, then they will go off on stream number 1. If they don't answer them so well, they'll go into stream 2.
Yeah.
because that then demonstrates that they will then, that's certain jobs and jobs that would be available to those nurses versus stream 1 nurses, etc. So getting 50.0001% may be a pass, but it's not going to get nurses where a lot of nurses expect to come. It is a crying shame for us when we see so many diploma qualified nurses working all over the world in health services, a lot in Middle East, for example. Okay. And what happens in the Middle East is they teach them critical care, neonatal nursing, accident. They teach them, they don't qualify them. So those nurses then come to Australia or apply to Australia and say, well, I've worked in Cleveland Clinic in Abu Dhabi for 7 years. I'm an ICU specialist and I'm a diploma holding nurse. And the nursing board says you're not eligible for registration because you have a diploma and you have no postgraduate qualification. You only have experience. Okay. So go away, get a qualification to formalize your experience, and then you'll be eligible for. Now we get these nurses calling us saying, what is going on? But that unfortunately is the process. So it's qualifications, and it's all about then it's about those qualifications. So getting 50.001% is not there. As Emil will talk about in a moment, the score for a nurse is 65 points within the migration pathway. But at the moment, what we're hearing is the average is about 75 to 80 points of the candidates who are being offered PR. So getting 65 isn't necessarily going, it might have worked in the past. It's not going to get you the offer that you're looking for today, because there's more nurses wanting to come and work and live in Australia. They're better qualified. Their English is at IELTS 7 or IELTS 8, for example. They're master's qualified, and they're now, they have more points. So 65 becomes 70, becomes 80, becomes 90, becomes 85. I understand, and you guys could tell me better. I understand it's about 75 to 80 at the moment is about the average. So, just passing through isn't going to help people realize their dreams.
Yeah. Thank you, Simon. And one student actually completed a 3-year diploma, the well-known one that from the health ministry, and she could be able to complete her the accelerated or the top-up degree from an open university, Malaysia. And since it's in the bachelor's level, will it be considered at AQF level 7, and will she meet the criteria to apply to the OBA?
And this is Hashani, yes. This will depend on the university. Okay. Open universities, online top-up courses. Some do and some do not. So she would need to, and that's where you would go through the self-check. Okay. And the self-check will and then she will provide some documents to APRA about her attestation and the course, etc., the unit she's covered, and then they will do an assessment to say yes or no.
Okay, thank you. Hope, Harshini, you got an answer for your question, how to verify your qualification. And another maybe question about, is it possible to get a job offer getting APRA registration, as we are not living in Australia? Why should someone pick an employee outside Australia instead of recruiting someone from Australia? It's a very beautiful question. I see got a lot of insight in this question. Hope the panel will agree with me. Simon, would you like to
look,
answer?
it is.
I think you answered to a certain level during your session, but you hope you will add some colors for this.
I've got about 25% of the answer, and I know the Destiny team has the other 75% based on their extensive experience. The first 25% is once you have your APRA registration, you answer one of the 3 core requirements for anybody applying for a nursing job is, do you have registration? Do you meet, which then means, and if you have registration, it means you meet the qualification standards and you meet the language standards, okay? Because you don't have registration unless you've got IELTS 7 or PTE 65, okay? So that takes care of, that's tick there. Then we get into experience. Okay, where have you worked? How long have you worked? What sort of hospitals have you worked? Local community public health versus have you worked International Hospital in Colombo, for example. Okay. And that's where then you join the rest of the international nursing community applying for jobs around the world. And whether that's a contract job or a permanent job, etc., that's where you join. And that is the biggest advantage of being on a student visa with a post and then completing your course and then having a post-study work visa. Because you're in the country, we would like to see you working part-time in aged care, which means you're getting experience in the Australian healthcare system. As soon as you're registered, you can then go and work as a registered nurse, and you're gaining experience, which then makes you invaluable to Australian employers. So we see it, to be honest, Sajith, as a small cost for a very long-term benefit, which is to gain Australian experience, which makes you valuable to Australian employers, which then means that you are, because you're in Australia, you'll be able to get those jobs.
So yeah, it is a key to stay back in Australia. For that, our Master of Nursing would be really helpful, not just for staying back, also to get an AQ of level 9 qualification in nursing, which would lead them into a leadership role in a hospital. So that's going to be, it's like an investment. It's like a good investment for students going for the Master of Nursing.
And that's a really good way of putting it, Dinesh. It's about an investment in your future. You know, it's about if when I went to live and work in Japan many years ago, the investment I made was in Japanese language. I was terrible at it, but in Japanese language lessons in order to be able to communicate and speak. That was my investment in that time. So I think you've got to look at it in that way. Now, that's not to say that a nurse in Colombo working at an international good hospital with good experience is also, great experience, would then go through and have just as much opportunity potentially as somebody else applying for a job. But if he or she is in the country, it just helps a lot.
Yeah, that's a good opportunity that student will have. And since we have some time constraint, I'll quickly ask the last two questions. We'll stick to these two questions and we'll move forward with the next session. And what if we start on master and follow in the OBA while on Australia? That's possible, Dinesh or Simon?
Yes. I mean, they can start with masters at the same time while they are doing the Master of Nursing. At the same time, they can do the OBA preparation with IHM. So IHM is the only institution in Australia who is providing Master of Nursing and OBA preparation at the same time from the same campus. So while they are doing Master of Nursing with IHM, they are also doing OBA preparation with IHM. So hopefully in the first year, they will be completing their OBA preparation, they will be completing their OBA examinations, and they would have already got their registration. So hopefully in the second year of Master of Nursing, they can work as a registered nurse. So they don't have to work in a cafe or anywhere else. They can work as a registered nurse part-time. So they will be earning a lot of more money. So which will be very helpful for them.
That's true. Thank you. And as the final question, I will ask, this is something about the student visa pathway. I may probably answer is after reopening the Australian borders, because they are starting the online master degree program. Nurses who are following the online master program can a student travel with their dependents? Like most of the cases, we check their GTE before they enrolling for the Master of Nursing program. If they qualified enough to apply through the with their family or the dependent, of course, yes, we apply all of their student visa together as a dependent, but they must satisfy the GTE criteria set by the Home Affairs. That's technically the answer is yes. Hope the panel will agree. The dependent,
absolutely.
if they agree. Yeah, I would like to invite Amila to go ahead with the migration outcomes and the pathways that you guys will have upon successful completing this program. But I would like all of you to still post your question on the chat box, but we may not be able to answer them today itself, but I will gather them and if possible, please drop your email address also with the question inbox to me. No need to put in everyone, just inbox to Sajid. Then I'll keep them available and I will write and answer all of the question with the help of Dinesh and Simon in future.
Right.
It's over to you, Amil.
Okay. Would you like me to unshare my screen, Amila? Have you got some slides you want to put up?
No, that's fine. Simon,
Okay.
it's probably like 5-7 minutes
Okay,
straight
no
talk.
worries.
Yeah. Okay, thanks, Sajid, and thanks a lot, Simon and Dinesh. It's a bit of, this is what we were missing in Sri Lanka. Like I've been practicing in the industry for last 11 years, and we were looking for an opportunity for our nurses to come here in a more convenient, more comfortable, more transparent way. And we had been doing that very successfully, all other occupation other than doctors and nurses. And the doctors, they had to do the AMC1. Then even they had the opportunity to go to India and go to Singapore and do AMC1 and come for the clinical exam for AMC2. But nurses did not have any option at all, you know. Then in that situation, I would say, and with IHM, and we are so glad that we have this opportunity, because with this opportunity, I can see that a lot of our Sri Lankan nurses who is qualified and who wants to come here and explore the next options for them, like for themselves being a registered nurse and for their family too. And while knowing that how much they can earn and how much return they can earn from their skills, um, it's a very huge factor, because say for example, and as Simon said, someone with a master's degree starting earning 90 to 100,000 Australian dollars per annum is in Sri Lanka is 15 lakhs rupees per month, which is probably, I really don't know whether a nurse can earn that money for the whole year in Sri Lanka, you know.
Yeah.
And it's not all about the money, it's the lifestyle, if the opportunity, it's good for the family and they can still earn and return some money back to look after their families too, you know. That's why, it's a very, very unique opportunity for our Sri Lankan nurses who is qualified to go with this pathway. I would say explore that pathway, because when it comes to migration, I'm not going to in detail of what Simon, Sajid, and Dinesh already explored and explained, which is already, and very, very, very clear information. But when it comes to migration, in the last couple of years, and what we were seeing from the system, from the immigration system, was even without COVID-19, we were pushing students to go and do nursing. The reason was there was a scarcity always. As Simon mentioned, now we're looking at 200,000 nurses in the next 9 years. And probably it's been, swamped because of the COVID-19. But even before that, there was a great opportunity for someone to get a PR with 65 points straight away. And for the question, maybe the Simon raised as well, and now it's like this. Australian system has point tested visa 189, 190, and 491. 189 visa is true that you need 80 to 85 points for nurses at this stage. When accounting IT engineers, they still need 95 points. But nurses are here not to score that points. Nurses are here especially for the state nominated visa 190. Myself successfully done more than 10 to 15 nursing nomination approvals from Victorian government in the last, I would say, 8 to 10 months, which we did not have any success to different any other occupation, only for nurses. The Victorian government and the other governments, they approved the 190 direct PR avenues for nurses, only having 60 points. Having 60 points is very straightforward. Okay. Because someone having more less than 33 of age can score 30 points for the age, and for the degree or a master's, they can earn 15 points. Australian studies, 5 points. IELTS 7 each or PT equivalents, 10 points. And they can do maybe 1 year work, then get one more stage, like 5 points for the Australian work experience, something like that. That then to meet the points requirement for Australian PR for nurses is still very comfortably they're doing. Even though they don't have the option go through with the 189 with the highest points, all the state migration plans at this stage, they open for registered nurses. Okay. And even for enrolled nurses who's having diploma in Australia, they had that opportunity too. But if you are RN, registered nurse, your options are very, very, it's expanded. Then there's another visa called 491. Say, for example, if someone's over 40 and below 45, because the Australian, the upper age for skilled migration is 45, they still have the option through a visa called 491, because you need just 50 points. And it's easy to get 50 points from your age, for your degree, for your English, and you can just add something like NATI or work experience, or from your spouse, because spouse can add 5 or 10 points too. Then meeting the points requirement for any skill visa like 491 and 190 is not a challenge for nurse, even they between the age between 40 to 44. Then especially for nurses, uh, we don't have any experience. A nurse here, either they are originally came for nursing studies or they changed to nursing from different discipline, and everyone had the opportunity to apply for either 190 or 491 visa in the last 12 months, especially with the COVID situation too. Okay. Then they started as a PCA for the aged care center. Then they accumulated some work experience from through that pathway, and they, smoothly, move into different stages in while they study. Then, therefore, this opportunity through IHM, and I'm pretty sure it's a golden opportunity for someone in overseas to grab this opportunity and see whether how comfortable they can create this pathway. But as I mentioned earlier, this pathway is not available for all other occupations. We don't encourage accountant. We don't encourage, the IT people, or administrators, HR people coming from customer service or coming from marketing. We don't encourage them to apply right now. In most of the cases, we would say opportunity would be very less. But for nurses, with their minimum requirement, the opportunities is very high. If you look at because the Australian government announced the migration intake this year for the 2021-22, they're still going to have the same number of places open, 160,000 for the program year. And last year, uh, the largest portion was given to nurses. I can't remember the exact number, but I think it's out of 80,000 skilled workers, 19,000 sort of a number given for nurses, then we can expect that the Australian government is going to give the same portion again or a little bit more, because as even Simon mentioned, they need 200,000 nurses in the next 9 years. If they can't satisfy that requirement within the domestic recruitment process with the Australian people, like people living here, they have to somehow turn to somewhere else, then this opportunity for someone in Sri Lanka or in overseas to grab that opportunity, and this is the right time to grab the opportunity too, then I will come back to a couple of questions raised by related to immigration by a couple of students. And one of the question was about the age limit. Since it's a Direction 69, the GTE criteria, because Direction 69 is the assessment criteria the Australian government put forward for assessing international students and the guardians. Okay. Now, when it comes to that, age acts as a fact, to assess you as a genuine student or not. But then the way we usually explain this thing is it has a bit of a flexibility, but if someone's in the age group of 30, around 35, 36, we would say, okay, with a bachelor's, yes, then opportunity to come for master's is high. But we still have seen that student with age 38 or 39, 40 still come for masters. It all depends on what's the gaps they've been having throughout, But say, for example, if someone's just completed the bachelor's after they did the diploma, when they were in early 20s, they did the diploma, they did the degree now, top up thing. Then since they do they do have the recent qualification completed, And there's a strong possibility if someone in the age group of 40 still could get a visa positive outcome because they already proved that they've been studying recently too to uplift their career, you know. But then for the bachelors, I would say we usually advise someone in the range, I mean, age range of 25 to 28 could probably the maximum to apply for the bachelors. But these situation could be changed for nursing because the reason is, as I said, um, they need more nurses, and we have seen that Australian government uh, assess the Direction 69 bit lightly, because they need more students to come here. And our experience, because we have done 30, 40 student visa in the last 12 months, even with the closure, we got every visa successful for different other course options. And we have seen that flexibility in the system because the Australian government pretty much encourage students to come here because they know that is a very big economical factor to Australia. They need money from international students, and the international students act in a different ways to contribute to the Australian economy. You know, then because of those things, uh, we can see that there would be some flexibility for students, especially coming from nursing. And therefore, if someone wants to precisely know whether they can apply for a student visa because of their age, I would like to have their profile assessed by myself personally and give that opinion. At the same time, there's another pathway for them. Since we do have a diploma nurse graduate certificate, you can do it in Sri Lanka, and the OBA, which you can do from tourist visa, visitor visa. There's even someone's has an age limit which is not supportive for the student visa. We still can, they still can make it a reality by doing the graduate certificate in Sri Lanka and coming to Australia to the to the rest of the short course OBA, then get the registration, go back to Sri Lanka, and apply from Sri Lanka as a registered nurse. And if someone is not having that, guarantee that they can apply for a student visa, I'm pretty sure we can explore the different pathway for them too. But then again, some other student asked the question why. I think Sajid already gave that answer, but why they want to choose someone from overseas when they do have someone in Australia? Then we know that they don't have much in Australia. That's the reason they want people to come and do nursing studies. And for studies, through studies, or if they apply from Sri Lanka because of they can't come for studies because of the age factor, then if you apply as a registered nurse through the 491, that's a regional sponsored pathway, or 190 state nominated pathway, there's a strong possibility you still will be get nominated. The reason is my quite simple example is I do have a client. She studied here, but she went back to Sri Lanka after she get the nursing registration here, and she got stuck. She got stuck, and because I mean she was having a student visa, then she can't come back because the travel restrictions prevented her to come. Then, then I applied to the Victorian government through the 190 visa as an aged care nurse for her while she was in Sri Lanka. That is the only permanent residency visa approved. The Victorian government approved in 2 weeks. Then the Australian government, then we submitted the visa while she was in Sri Lanka, registered nurse, and they approved the visa in 2 to 3 months, which is in average 9 to 12 months processing. And she straight away got the travel exemption to come. No problem at all. Now she done the quarantine last 14 days, and now she started working straight away. Okay. And that's the, I mean, that's the the very new example I can tell you how the Australian government treat nurses. Say, coming back to the same subject, some student asked the question, I think, borders are closed. Yes, true. But you know the strategy of the Australian government. The strategy is, if you are studying in an area which is important for Australian government to recover from COVID-19, you will get the priority to come here with a travel exemption, even you are a student. That was in place before. I'm pretty sure that would be something you can also try. Say, for example, we applied for the visa for you. You got the visa, but then the travel exemptions has to be applied, which we are more than happy to do it for yourself for free, honestly, because if you're our student. Because we do have other students, they already got the visa, they don't approve. But I'm pretty sure for nurses, they will definitely have a different strategy because they know once they hear, they can make use of them. They can use their skills too, you know. Then even you have a student visa, and even with the travel exemption, with the all the restriction, I'm pretty sure there's a certain possibility a nurse can come here, student, over someone else who already got the visa. Okay. Then another question, yes, I think I wanted to answer. Okay, I addressed the age limit question. I think I addressed to the points requirement, which you don't need 85 or 90 points. You can apply from 50 or 60 points. Then I want to address to another question about the travel exemption for nurses. And yeah, I think I want to address those questions too. Then I'm pretty sure the answers were clear. But then if someone's having any question about my answer. So if they do have any immigration sort of question, you can just drop in your question here with the email. Then not now. I will make sure that I will address to them personally. And thank you for all, and thanks Simon and Dinesh and Sajid. Then I'll Sajid, you can take it back and conclude the session.
Yes, thank you so much, Shamil, and the faculty members for giving, and the panel members rather, giving your insight and sharing your knowledge, how easily and what will be the opportunity. The As Amila explained, this wasn't there, or that opportunity wasn't there for the Sri Lankan nurses, because I can endorse how qualified are they and how they can perform once they become a Australian nurse, because they were going through a rigorous course, and they are well qualified enough during their studies, as well as during their probation period. Plus, they have a good number of years service, who have been caring about the Sri Lankan healthcare sector and doing their noble service to the community. But this is one of the best opportunity for you guys to see a different level and grow your career in Australia. We welcome everyone, and while thanking everyone for admitting and supporting today's session, and we again thanks all the participants who uh, attended today's session to gather the knowledge. But you guys been working with Dulmini, the in charge, who has been working towards enrolling you for the nursing courses, and we are here to help you. I'm passing my WhatsApp number here. Yep, as well as you all have the Dulmini's number, as well as her email address. Direct any question through WhatsApp for me as well. Then we will here to help you. And I must again thank IHM team, who immensely helped us for educating our community today to see a good future for their nursing career, through their nursing career in Australia. And thank you, Amila, also, and the team joined today. And have a wonderful weekend for you guys.
Right. Thanks, guys. And we hope to see you in Australia.